Dr. Phyllis Davel. I'm a family medicine physician, and I've been deployed to San Salvador.
Hello, my name is Dr. Keisha Camille Smith, and I'm a family medicine physician, and I will be deployed to the island of Bimini.
My name is Nicole Adderley. I am a family medicine specialist with subspecialty training in skin conditions. I am deployed to the beautiful island of Exuma at the Georgetown Clinic.
I'm Dr. Alan Cho. Basically, I'm emergency medicine physician. I've been deployed to the Berry Island under the government of Bahamas.
A family medicine doctor is a doctor that has been trained in family medicine.
So we've done extra training in the field of family medicine, which encompasses, they say, from the cradle to the grave.
In the Caribbean and in the Bahamas, the premier institution for postgraduate training is the University of West Indies. So we have undergone 4 years of intensive training, which included rotations through the major specialties and minor specialties. And also we did a research project studying the people and the residents of the Bahamas.
I was actually in internal medicine for 4 years before I decided to embark on family medicine. And working in the Department of Internal Medicine, you see a lot of chronic cases, chronic non-communicable diseases that come in to the hospital, and these are frequent flyers, people who have uncontrolled hypertension, people with uncontrolled diabetes. And a lot of people who never even knew they had any issues of hypertension, diabetes, or even breast cancer until they present to A&E with a stroke or heart attack or whatever they may present with.
Non-communicable diseases is definitely a problem, not just in New Providence, but in all the family islands. And this is why we need physicians to go to the family islands to address these issues, to prevent certain diseases and to manage them early to prevent complications.
To truly combat the problem of chronic non-communicable disease, one has to attack it from the primary care base. I initially spent 4 years in the emergency room prior to entering the family medicine program. And so in the emergency room, we saw the end result. We saw the patients coming in with the heart attacks and the strokes. We also saw the patients who were coming in chronic renal disease and fluid retention. And a lot of the times, these patients were either didn't know they had the condition or they did not follow up. And so the tertiary care institutions are usually based on treating the end result, but we need to put our resources into the primary care so these patients can have better control of their high blood pressures and their diabetes and their elevated cholesterol, so we don't see the end stage of these diseases. The CNCDs are a big burden on the healthcare system. For the most part, they usually present with little or no symptoms at the start of the disease, and when they do start to have symptoms, it's usually end stage. And it's very costly to the system. So it's wise to put your resources into the prevention and the early treatment than to put it into the management of the end stages.
I never thought that I would appreciate being a public health doctor, going to as compared to the emergency medicine which I have been doing for most couple of years in my country. Because in emergency medicine, you see a patient, treat the patient, and after that the patient is discharged after you treat them. But when you get immersed on the clinic itself, you get to talk to the patient, not only with regards to their illness, but with regards to what they're feeling. There's a continuing service, not only in the clinic, but after they go back to their homes, on how they it's like not only as a being physician, but as being as a friend to them.
The people of San Salvador, they should know that I'm a pretty down-to-earth person. I grew up in the family island, so I could relate to a lot. So they shouldn't have to fear me at all. I am just like anybody else. I can have jokes. Just treat me like, how you would treat anybody. So I want to be part of the community and be accepted. And because the more we can have open lines of communication, the more information I get from a person, the more we can work with to better that person's condition.
I'm a very caring person. I'm very passionate about what I do. I enjoy what I do. And that when they come to me, they can be reassured that they will be getting some of the best medical care I can offer to them.
I'm hardworking, I'm passionate, easy to get along with, and I'm here to serve them. I've been given an opportunity to serve the people of the Bahamas.
I'm just a very simple guy. I don't consider myself as a doctor, but as a friend to them. A friend in which they could always talk to, relate to, reach out to them, and at the same time, be a professional doctor in treating the whole community with regards to their illness.